All right, so this video I'm actually really excited for. It's a way for me to really kind of self-reflect on how I think this past semester went. So at the very beginning of our semester, within the ISU DAT, we do a professional development plan, and then within that plan we have specific clinical goals and educational goals that we hope to obtain throughout the semester. So this is just a quick kind of reflection on how kind of maybe I did on those goals, and then also, okay, if I didn't achieve those goals, or even if I did, and how I want to continue to implement those goals, basically an action plan that I can take for leading into the following semester and hopefully throughout the rest of my time here at ISU. So, I think when I look at my specific goals, one of them will the two main things that I really wanted to work on was implementing interprofessional collaboration or communication, and then also evidence-based medicine, because those were kind of the two in the middle of the semester that I kind of realized that I was lacking on when I was doing my clinical surveys at the end of every 2 weeks. So, and I think the reason why I really wanted to work on these is because it gets me out of my comfort zone, right? So actually talking and advocating for my profession with other healthcare medical professionals is very important, but also kind of nerve-wracking. And I think I work in a really cool setting where I get to work with a lot of different people, and it is kind of just breaking out of that comfort zone and doing something that maybe I haven't done in previous experiences. So reflecting on, I made a goal of going to the provider meetings, which I'm happy to say I have actually started going to. I haven't spoken at one yet, but I'm actually now going, and before only physical therapists and physicians used to go. So now it's really cool because athletic trainers get to go. My colleague doesn't go, but I've been going, which is really great. So I've been getting really great information from those meetings, and I'm hoping that next semester I can do a presentation with our sports medicine physician and my supervisor. Also on Wednesday mornings, physical therapy usually had their weekly meetings, and I actually went up to them and I said, hey, I know we're not quote unquote in the same realm, but can Smart Clinic, which is the athletic trainers and sports medicine, can we actually come over to you guys in the morning and be a part of your weekly meetings? And the lieutenant was like, yeah, of course, I think that's a great idea. Who our lieutenant actually happens to be an athletic trainer and DPT, so she is very pro athletic trainers, which is really awesome. And sometimes we don't always have that privilege, but I think she understands what we do because she's an athletic trainer as well. So she was definitely for it. And then within that, we started doing, one of my other goals was evidence-based medicine. And so I wanted to try to read a article a week and do that with someone within my DAT class. I didn't reach out to my DAT class, but now we have started at those weekly meetings for the physical therapy SMART combo. We are reading a weekly article. So it's really great because then we get to reflect. So usually the lieutenant will send out, hey, this is an article I want you guys to read, look it over, and then we're going to discuss it on Wednesdays. I've only been to about 4 or 5 of those meetings so far because we just kind of started implementing it. But that's one thing, my action plan going forward, that I want to continue with is making sure that I continue to go to those meetings and advocate for the SMART Clinic with a collaboration of physical therapy. There's been this really big divide since, I guess, before I got there, where SMART Clinic and physical therapy kind of had a rivalry. And if we go back to, interprofessional practice, that's not what our goal is, because our goal is patient-centered care. So it's been really great to start to implement that. And I'm really eager to, again, continue to get out of that comfort zone and, be the athletic trainer that is trying to break that stigma, and also having positive people around me that are kind of looking and go, why do we even have this disconnect? I think we had this disconnect because there used to be an individual there that doesn't work in that clinic anymore that really tried to divide us. So now that the person is gone, we kind of look back and we're like, why don't we get along? Well, there's no reason for us not to get along because, our overall goal is patient-centered care and providing the best care to, our tactical patients. So I think reflecting on that goal, I didn't do exactly what I wanted to do with implementing it with my classmates, but I have altered it a little bit. And now I'm working on that within my own clinical practice and not within my DAT colleagues. And then one more for implementing interprofessional practice and or collaboration communication. I did something super cool that I was super nervous about. But so one of the senior medical officers, she's a lieutenant. She is a doctor of osteopathy. She's on one of the ships. She actually had reached out to physical therapy and asked them if they wanted to do a preventative medicine seminar on the ship, but PT didn't really want to, and I totally actually, without really thinking, I was like, yeah, I'll do it. And then all of a sudden I was like, holy crap, what did I just do? But I'm super excited that I did do it because I got to go on the ship and and then using one of my lesson plans for athletic training education course with Dr. E, excuse me, we got to play, I used one of my games, played Simon Says, which is really cool because here it was a combination of interprofessional practice with working with a different type of healthcare provider like a DO, a doctor of osteopathy medicine. And then I grabbed patients from, or not really patients at that moment, but sailors out of the like kind of out on the ship, and we played Simon Says with preventive medicine. So it was like Simon Says, squat to the floor. And so we got to break down each movement, and I got to kind of talk to them about, hey, with this person, they're leaning too heavy on their knees, which could which could lead to kind of patellar tendon issues or kind of overall anterior knee pain. But hey, if you look at this person has really good trunk control. They have their weight back in their heels, but their toes are still engaged, and so it was really cool. And we did like a lot of preventative overuse injuries, so overhead reach, things like that. So that was super awesome because it got me totally out of my comfort zone, and but I also got to really advocate for our profession and tell them really what athletic trainers do. And when I mean tell them, I'm talking about just the sailors in general. I'm talking about the CEO of the ship. We're working with, I don't believe they had a physical therapist on the ship, but they obviously had not a medical doctor, but a doctor of osteopathic medicine. So it was just really a great experience that I truly don't think I would have done if I wasn't in the program. So I'm hoping to try to reach out to the ships a little bit more. I'm still working on trying to determine how to do that. But I think I'm going to continuing to talk with that ship and hopefully their referrals to other ships. I might be able to kind of implement that as like a monthly thing, but again, I'm not too sure per military protocol if I'll be able to do that. Going forward, implementing the clinician and patient rated outcomes. Ironically, with this class, that was one of our projects. So that was one of my goals at the very beginning of the semester, was implementing those. I'm only using kind of the FODI, the foot and ankle, and then the shoulder disability. So I haven't implemented the kind of the knee or the back or any other injuries that I might see. But my action is to continue to implement those and then maybe add in a knee one. I need to do a little bit more research and find out which knee clinician, well, not knee clinician, knee patient rated outcome I'd like to use. But I think PT already has one, but it's like more of a functional scale, so I don't know if it's very specific to the knee. So my action plan for that is during my little break that I have is to kind of really research and even send out an email to the MCRD, which is another smart clinic, and determine if they're using them and which ones they're using, because I think they're kind of more sport specific instead of kind of chronic pain. So that's one of my specific goals that I want to do during the break. And I think my reasoning for why I always thought that I wouldn't have time to implement them, but I quickly learned that that's just a stigma that is a barrier that obviously I'm also learning in my research program, that I do have time to implement them, and they don't take as long as you kind of do the research. And I'm glad that during summer we were able to kind of look into different patient and clinician rated outcomes, and I was able to not just choose one out of hat. Like, I was able to really break them down and figure out which one would be best for me. And I did learn quickly in my implementation project protocols that worked and protocols that didn't work. So that's been super helpful and I'm also just really, really eager to continue that. Going forward, one thing too that I really wanted to work on was being an empathetic listener. So I think in the military, sometimes they are little robots, and people or clinicians kind of forget who they are. That before they're a sailor, they're a brother or a sister, or a father or a mother, or whatever the case might be. So I've been really trying to empathetically listen to my patients a lot more, and not listen to respond, but just listen to listen. And within that, I think I referred like 3 or 4 people to mental health this past semester. I didn't do anyone during summer, but that I've seen a really great turnaround, because I think there's a negative stigma in the military for mental health referrals, and just because someone is seeking health mental health help, like seeing a psychologist or things like that, it doesn't mean they're not fit for full duty. It just means that, hey, they're going through some tough times. And I think we can easily see that in the last 2 weeks with the military shootings that we've had at the naval base in Hawaii, which was actually an active duty military or sailor who killed 2 contractors. And then obviously the recent one in Florida was more of a Saudi Arabian student that was practicing. I don't know if I'd be able to, but within that, but really reflecting back to the Hawaii outcome, there's a big stigma that we're not helping our patients, and we're not helping our sailors and our military members, and how much stress they're under. And just because they are seeking, or really even asking for mental health, doesn't mean that that's a problem. So that's been one thing that I've been trying to do and break the stigma. But luckily I have a really great site supervisor that encourages that, and he doesn't frown upon me if I say, hey, I'm worried about this kid. I think that we should just send him a referral for mental health to get looked at. And if mental health decides not to do anything with it, that's great, but at least I did that. And then I guess really continuing to go forward, I kind of talked about my action plans intermittently throughout the video. One thing that I really struggled with this semester, which is ironic because I was way busier last semester than I was this semester, was time management. So I have started using Brandon Burchard's high performance planner, and it's great because it allows me to look at my week, and then every single day I have to write in it, and I write it in the morning and I write it at night. So in the morning it might say, what is something that I am stressing about today, and then an action that I would do to ease that stress. And then at the end of the day it says, reflecting on how your day went, how do you think it did, how do you think it did? And then it has specific criteria for, how my energy was, how my clarity was, my mission, my things like that. And I've seen in the last about 3-4 weeks I've been using it, this really great increase of like focus, and not being really crazy all over the place. So my goal is to continue to use that because it's helping me a lot, and to perform as a high performance. Even as an athletic trainer, I need to continue to implement and self-reflect daily, not just a monthly thing, but a daily self-reflection on how I'm doing and how I can improve each and every day. And then last, I still want to implement kind of data for Smart Clinic. I kind of did that a little bit with my implementation project, but it was obviously only for like 5 patients. But I think taking stats next semester, hopefully I'll learn maybe some ways on how to, keep my records for my Smart Clinic patients, and then turn them into statistical data. How many ACL injuries are we getting every month, and things like that. And I think kind of just doing a little bit of research prior to the semester, and maybe even reach out to my colleagues and my classmates and ask them, hey, how do you guys do that? And if they have any certain programs that they use, because I know in physical therapy at our clinic, they don't do it. Like, they have like a set of people that do it for them. It's not the providers themselves. So I think overall I really grown a lot this semester. I've seen so much growth even in the last 6 months that I've been in this program, and I'm just so eager and excited to continue to see the growth, and also really appreciating the fact of the self-reflection and realizing what I can continue to improve on, and also just valuing how much I have grown, and that's been really great. All right, hope you guys like this video. Bye.